Hello, 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 family. How are you today? I am excited once again to be here with a new topic. We are in theme 5. We've been having these discussions for the past 5 months. And so we are today on theme 5, session 2. And my name is Quanisha Johnson. I am a licensed counselor and licensed educator. And I am going to get it started so we can get this conversation going. It's such an important topic today. And we are going to be talking about and continuing our conversation as it relates to racial trauma in our health. Well, let me just get our screen going. Get us going here. Get the party started. And playing our video from the start. So our specific theme 5 is going to be in relation to racial identity and trauma. And so we're going to be unpacking that. And that's what we'll be doing for the next few weeks. And so today's session 2 specifically covers the correlation between racial trauma and your health. So as we unpack and make that connection between what our racial identity is and how trauma connects to that or plays into that, we are specifically today going to be talking about the correlation between racial trauma and your health. If you didn't have the opportunity to tune in to our session 1, so last week's session, we talked about where it all began in childhood. And we looked at the lens, we looked at ourselves as adults through the lens of childhood trauma, like where everything started, where a lot of those experiences shaped who we are today. And so I just encourage everyone to kind of take a look at that. And I often make connections between the different sessions to tie into one another. So the correlation between racial trauma and your health, so important. So racism, as we're talking about racial trauma, I wanted to make sure that we took a second to really look at what racism is. And I took something specifically, a definition from the page of the CDC. I know lately, due to the pandemic, a lot of people have been watching and listening very closely to the words, the recommendations of the Center for Disease Control, and often quoting them. Now I'm going into different places in the community, and there's signs on the door that state, according to CDC recommendation or guidelines, and then it discusses about masking. So now I went on, because we're looking at them so closely, wanting to draw from their definition and share that with everyone as we go forward in talking about racial trauma. So here they have racism is a system consisting of structures, policies, practices, and norms. Once again, a system. So when we think about the idea of a system and what a system looks like, right? Consisting of structures, policies, practices, and norms that assigns value and determines opportunity based on the way people look or the color of their skin. So we are assigned value, and opportunities for us are determined specifically based upon the color of our skin. And so there are structures, policies, and practices put in place in connection to that. This results in conditions that unfairly advantage some and disadvantage others throughout society. And this is from the Center for Disease Control. And once again, we want to look at that word assigning value, or that phrase determining opportunity. And this is all, as they're stating, based upon the way that someone looks. something that we have no control over, when we're born, our skin color, based upon race, which actually is a made up construct. And so having this system put in place that basically tells us that you're not going to receive certain opportunities and you'll be disadvantaged merely and simply, not because of your ability, not because of your skill, none of those things, but because of how you look. Racism, as it states from the Center for Disease Control on their page, both interpersonal and structural, right? So we experienced it interpersonally, seeing for example, myself and someone else, myself in a group, and then the structural part of it. And so ultimately negatively affects the mental and physical health of millions of people, preventing them from attaining the highest level of health and consequently affecting the health of our nation. So we're listening to what they're saying in terms of guidelines and recommendations. And so, although this is not new, so this statement was put out this year in 2021, but ultimately this is not new to us. This impact on the mental and physical health of millions of people. So this racism, this thing, prevents people, us, from attaining our highest level of health. So today, remember, we're talking about that connection, that correlation between experiencing racial trauma. So you experience racial discrimination, and as a result, you have an experience of trauma. And then as a result of that, your health is impacted. And if our health is impacted, even though we are 13% of the population, if we're a part of this nation, a part of this country, if our health is impacted, it affects our entire nation. I know everyone doesn't see it that way. They go on, and this is still information from the Center for Disease Control. I am getting this directly from them, but I thought I wanted to touch on just what it looks like. It's an in-depth definition of what racism is. A growing body of research shows that centuries of racism, remember, centuries, this is not like just what we're seeing today. This is not what happened 30 or 40 years ago. This is centuries. That centuries of racism in this country has had a profound and negative impact on communities of color. The impact is pervasive and deeply embedded in our society. It's embedded in our society. It's there. Even when it's not overt, it's there. It says affecting where one lives, learns, works, worships, and plays, and creating inequities in access to a range of social and economic benefits. So going back to that, deeply embedded, and it impacts where you live, the location of where you live, where you learn, the job opportunities that you receive, where you work, the place where you worship, where you play, where you have a good time and enjoy yourself. And those inequities are created, and there's a social and economic impact to that. So we see that in housing, we see that in educational opportunities, we see that in access to wealth, systems put in place that get in the way of Black people accessing and having access to wealth, having access to employment. And so these conditions, as the CDC states on their website, often referred to as social determinants of health, are key drivers of health inequities within communities of color, placing those within these populations at greater risk for poor health outcomes. And so I wanted to pull this information. So as Quanisha Johnson, the therapist and educator, is talking, and that we're understanding that this information, although for the rest of my information comes from various sources, experiences, this information here I'm reading comes from the Center for Disease Control. And so racism is a threat to Black people, and it's a threat to our entire nation. And so I wanted to show you, first, we have racism. And so as a result of racism, things that create inequities in society based upon what we look like, there are less opportunities. So when I say racial trauma, I want to just I'm just going to look at trauma. And we looked at this last week with our prior conversation about childhood trauma. Just what is trauma? When we hear that phrase, trauma refers to the intense, overwhelming experience that involves serious loss, threat, or harm to a person's physical and or emotional well-being. Intense, and it's overwhelming. And it could be something physically happening or a threat of the loss or the harm. And I want to highlight the phrase well-being today. So when we think about well-being, and then even if we put it in relation to the definition or the information provided by the last few slides with the CDC, well-being, and I'm just going to simplify it, but just make it make sense from what they're saying to what we're going to get ready to talk about in more detail. Well-being is the state of being comfortable, healthy, and or happy. So when I hear the phrase well-being, that involves comfort, health, happiness. If I go back to just the sentence here, and I flip back, I don't usually do this, I am going to do that today. The impact is pervasive and deeply embedded in our society, affecting where one lives, learns, works, worships, and plays. Where you live, learn, work, worship, and play is connected to your well-being. It's connected to where you are comfortable, where you are healthy, and where you are happy. Reflect on if you've ever lived somewhere you didn't like living, but you had no choice. Reflect on being in an educational setting or environment that was uncomfortable and you felt unhappy. Reflect on the idea of work, right? We choose, we go to school and we get a job, not because people love their jobs. They do, some don't. And we want everyone to be passionate about what they're doing. But first and foremost, people need to pay their bills. People need to pay for their housing. People need to pay for their food, and so on and so forth. So ultimately, when I think about racism, the impact is pervasive and creates inequities, right? Such as housing, education, wealth, and employment. How does that not connect to my well-being? I can't separate it. So this conversation is about correlation. If racism does this, and I go back to trauma, where there is intense, overwhelming experiences that involve serious loss, threat, or harm to not only a person's physical, absolutely it's going to be physically harmed, but also your physical and emotional well-being. That word, just well-being. Your well-being is threatened. I'm experiencing trauma when my well-being is threatened, when my ability to be comfortable, when my ability to be healthy, my ability to feel happiness is threatened. These experiences, they can occur with trauma at any time in anyone's life, and they can involve one event or maybe be repeated. But we know, today we're talking about the connection of racial trauma. We know it's not one event. We know it's not one event. So maybe personally, someone may be able to say, I had one experience that was traumatic as it related to my race. But in terms of the exposure to it, it's more than one. I can say that for a fact. If you've gotten to be 21, you've had more exposure to racial trauma than not. You may have had one or maybe not any personal experience where you were maybe physically harmed or threatened physically, but your emotional well-being, right? The exposure to the trauma, the exposure to things, you've had that. These traumatic experiences, right? This is what we talked about last week, often overwhelm someone's coping skills. You don't have, and coping skills are what we do to manage our stress, manage what's going on, manage experiences that are unfavorable, what we use to get through. So when we deal with the trauma, often when you're so overwhelmed and your coping skills aren't as accessible to you because you're so overwhelmed and the feelings are so intense, then there may be other behaviors that occur that bring relief in the short term that don't have the long-term efficacy that you really need to get through. And so now we talked to some about racism, that system. And so in terms of racial trauma, it's the ongoing results of racism. And we talked about what racism looks like, what racism is. It's a system. It involves structures, policies, practices, norms that give value and determine who you are based upon your color, that you have an unfair disadvantage based upon your color. And so when we talk about trauma, a threat to our physical or emotional, mental, our well-being, if it's ongoing, the trauma is the ongoing result of the racism, the bias, and the exposure. As I said a few minutes ago, I said you may not have had a physical experience, but you have had the exposure most likely. And so that whole idea of it being ongoing over and over again. So it's like, how do I heal when I'm exposed to it, when it's ongoing, when there is a system with structures, policies, and practices in place that are created against me because of how I look? And so not giving me fair access to housing, to wealth, to employment, to my well-being, which once again is my comfort, my health, and my happiness. All of that threatened. Racial trauma can affect many aspects of a person's life, and that includes that ability to just have connections, relationships. You don't trust. People who go through trauma in their lives have, and not all, remember, nothing, no definition, no examples are all encompassing. And so many people who deal with trauma struggle in their relationships because they don't trust. They don't often feel safe to open up, to connect. There's barriers up for safety. And so that racial trauma can also have an impact on focus, concentration at your school or your work. It gets in the way, once again, of that ability to feel safe. And we can talk about physical safety. We can talk about emotional safety. But just the idea of feeling like you are free from harm. I want you to just reflect. Do you feel as though, in terms of your race, how you show up in the world, that you have no choice? There is nothing I can do with the skin tone. This is my skin. This is what color it is. as a result of my skin tone, do I just feel safe and just baseline safety, walking down the street, driving in my car? And so ultimately, it is very impactful racial trauma. We have racism, and as a result of racism, ongoing, not an incident. And I'm not diminishing an incident where I've worked with people who said they were walking down the street and someone just rolled their window down, called them the N word, and kept driving on. That is uncomfortable. That's traumatic in itself. I can't judge that. But that one experience, if that person just had that one experience in life, although it's a violation, it's traumatic, it's harmful, it's different if that was just it in our lives. Like we just had to deal with one negative experience. It's ongoing. It's in systems. Things are in policies. And so we'll talk more as we go along to provide more examples of what that looks like. So it negatively, as we already said, racial trauma impacting your mental and physical health. There are negative psychological outcomes, and we don't just see it in adulthood. As we talked about previously, we see that in childhood. We talked about the adverse childhood experience, the ACE, and basically just a big study, and the CDC happens to take a part in that study, just looking at how childhood trauma had an impact over the lifespan. Like what happened in a child's life, the number of experiences, not a single event, but the number of traumatic experiences in childhood and how that impacted them over time into adulthood, through adulthood. And basically the study finding that there were adverse neurological effects, biological effects, psychological and social effects of these adverse childhood experiences. And so basically they would ask certain questions. The more traumatic experiences, the more adverse childhood experiences, the higher your score is, the more that you are susceptible to these negative health outcomes. And so ultimately, so we see that, like, you know, there are negative outcomes to trauma in general, specifically racial trauma, the earlier that you experience it. The earlier it's experienced, now you have these experiences, what happens over time? How do these negative experiences impact you through adulthood? Then we have the idea or concept of intersectionality. And so we're talking about Black people, African Americans experiencing racial trauma, but then we can't forget or neglect the concept of intersectionality. And that's the idea that when you're a part of more than one marginalized group, there's an impact, a greater impact and response from the racial trauma. And oftentimes we forget about intersectionality. We forget that, for example, and I'm going to show that example here, we have Black women as that example. Two marginalized groups. So this is what intersectionality looks like. So when we talk about intersectionality, we got to talk about what happens with Black women. What is the impact? So you are, as a Black woman, if you're a Black woman or you identify as one, you're dealing with being Black as your race. And then you're dealing with being a woman and what comes along with that, and discrimination based upon that, and lack of opportunities based upon that. And so we would be remiss to provide support in place, or put supports in place for a Black woman that only go along with what she needs as it relates to her race, and not think about what does it mean in relation to her being a woman. And so that idea of intersectionality, and we often forget that. And so we're talking about dealing with racial trauma, and dealing with those inequities from both ends. Doesn't mean that Black men are not experiencing this absolutely positively, but we don't want to forget what it comes along with both being Black and both being a woman. So this is just what intersectionality looks like. And this is information that when we talked about that strong Black woman trope, that we often see and hear about, and this is a result of that. Black women, 3 to 4 times more likely to die from pregnancy complications than white women. Black women, 3 to 4 times more likely to suffer from a severe disability from childbirth than white women. Minimal government research funding for uterine fibroids. Why? Who, if you don't know, who suffers more from uterine fibroids? We do. So what is the irony in the fact that, or is there a connection, or is it just happened that way, that there's not enough research and we as Black women are the ones suffering? So there's the support for it, the research for it is minimal, and we happen to be the ones that suffer most from having fibroids. Coincidence? I think not. Black women reporting just in their going to the doctor, and I can speak to this as being a mental health professional and talking with my clients about an array of issues that relate to all aspects of their life, one being the health care they received in terms of going to a primary care physician or just getting other services and feeling as though they're not taken seriously, feeling as though that their pain's not taken seriously. More as Black women, biological wear and tear from chronic stress, and we're going to talk more about what that looks like for Black people in general, but just these experiences of being Black and then being a woman and what it looks like, and then not wanting to, and then now feeling like you have to show up strong. And these are traumatic experiences. It's beautiful to carry life in your body, but then to read 3 to 4 times more likely to die from pregnancy complications or suffer a severe disability from childbirth, to know that, you may have fibroids and there's you have to suffer, get them removed maybe, but the research that can be done to help you to get medication, to just figure out like how do we reduce it, because it's something that Black women suffer from. So when we go back to well-being and racial trauma and the idea of my well-being now relating to my comfort, my health, my happiness, I'm carrying life, but I'm more likely to die during childbirth. I deal with more chronic stress. So just being mindful of these are all traumatic experiences, and remembering once again, trauma is a personal experience. It's personal. So although we're talking about a group of people, we're talking about us, remembering that how we each experience trauma is personal. It's often important, just as important, and we stated this last time with children, the perceived trauma in relation to what someone thinks really happened, that perception is important. If you perceive a lack of safety, a threat to your well-being, and you perceive that, that's what's important. It's not what someone says, well, you should be fine. That doesn't impact you. That didn't happen. That happened a long time ago. Things we've heard before sound familiar. And so ultimately, just looking at it from the standpoint of, if you experienced it, if you feel it, it's real. And it's not based upon someone telling you that that's not happening. So your trauma is personal. Although we collectively have an experience as a people, how you experience it is personal to you, and no one can tell you you shouldn't feel safe, or you should feel fine, or you're okay. And so lastly, just kind of just giving another example, just Black women, more than half are over the age of 20 are obese. And there's so much that we experience not wanting to share our pain, that we don't feel well, and not trusting doctors, just from experience, not because we just don't want to do it. So a little bit more, just kind of Black women, more prone to develop high blood pressure. We talked about obesity, and our Black women are more likely to die from breast cancer. And that correlation is just the delayed healthcare seeking. You don't want to go to the doctor because it sometimes is a traumatic experience, the way that you're treated, the way that you're ignored. And so these things are real. These things happen. So more on the impact of racial trauma, and let's talk a little bit about mental health specifically. So I always talk with people I work with, my clients, when I do presentations in my community, really kind of making sure I beat into the ground the idea that mental health is health. It's an aspect of your health. And so often we are more aware of how something impacts you physically, of course. And we're conditioned to do so. You know, you're a little kid, and you're conditioned, if you fall, you want a Band-Aid, you have a boo-boo. And on the opposite end, we're told not to cry. What are you crying for? Stop crying. And so ultimately, I'm just here to tell you that your mental health is health. So when we look at racial trauma, we're going to look specifically right now at how that impact on your health connects to the mental part of your health. So we see when people are experiencing racial trauma, that ongoing racism, ongoing racial bias, right? That trauma threatening our well-being, threatening the threat of serious loss, harm. We have symptoms of PTSD, which is post-traumatic stress disorder, and that can develop as a result of traumatic events. When we see PTSD, it was often thought of, and that has changed, of it's someone coming from war, that this is who experiences post-traumatic stress disorder from war. And it was discovered that it's not just soldiers coming from war and having those experiences, that you or I we were able to have that negative impact as well from events in our lives, traumatic events. And so with PTSD, we see intrusive thoughts. And so when we think about intrusive, it means like, I'm trying to focus. Think about the word intruder, right? Just the root word. So when we think about intruder, we think about somebody coming in and they're not supposed to be, when someone intrudes. So that's what happens with PTSD, with those thoughts. They're intrusive, they're intruding. They're there and they shouldn't be, and they're there and they infiltrate your thinking, and they're in your brain, and you're supposed to be doing something else, or thinking something else, or focusing on work or school or play, and these thoughts are there and you don't want them there. They're intrusive, the memories, flashbacks, and avoidance of anything associated with that trauma. You don't want to be exposed to it, so you have avoidance. So that's an example. So when we have incidences where we are exposed to these traumatic events over and over again, we have the PTSD, and then we can also look at chronic stress. So chronic stress, and if we think about stress in general, okay? So we all experience stress at some point in our lives, right? Stress happens. It's the biological response, when there's a demand. That's really what stress is. And we feel like we can't meet that demand. So we feel stressed. And think of all the situations. It's that feeling, I can't meet my demands. It could be anything. So think of a situation where, let's say, I am running late for work, and I only have 5 minutes to leave, but I haven't even put my clothes on yet. And I'm talking about something very simplistic, even though we're talking about a very heavy topic. I just want to like bring light to this general stress. You can't meet that demand, so your body has its biological response. I'm gonna start, my heart's beating fast, I'm sweating. I feel jittery because I feel that I'm having this biological response to the idea that I cannot meet a certain demand in a situation. I use late to work, you can use anything. Stress happens. So once I get in the car, let's say, and I'm on my way and I made it through the 5 minutes and I take a deep breath, I might be okay. And so during a stressful situation, we have that like biological response. I'm gonna, because I feel stressed, release, a hormone called cortisol. Then maybe the adrenaline, another hormone that's pumping through, and that happens. Boom. But I'm talking about when we're dealing with a traumatic situation, traumatic events in our life, we're going to experience chronic stress. That's prolonged. That prolonged pressure on the body, the prolonged pressure on your body, the idea of the body constantly having to rev up and then try to come back down, revving up and then come back like an engine, revving up, coming back down. So that chronic stress is so unhealthy for the body. The body is designed to deal with so many things. And when we say stress, we're designed, our bodies we were designed to deal, to try to function through. But it's a constant revving up. And that is what it looks like, that feeling of just always having to be on this alert. And we'll talk more about being on alert in a couple of minutes. So we see that experience of that chronic, that long term, where that pressure, that stress is constantly on the body. And so we also will see anxiety and depression, right? Anxiety refers to that feeling of fear or apprehension about the future or what's to come. So when we go back to that definition of what racism is, and all of those things threatened by just being viewed a certain way, treated a certain way, having inequities because of the color of your skin. And so ultimately, it's that fear or apprehension about what's to come. What's the future going to be like? Am I going to get this opportunity? I think simply just about like the idea of, let's say you want a job, you need a job. And all that goes along with I think about being a Black woman and how I prepared for jobs I really wanted in the past, and the thoughts that I had to have that maybe my white counterparts would not have to have. So the idea of thinking of, I really need this job. I really need this job opportunity, whether it be for financially. My family, the schedule was great for me to pick up my children. But now the pressure, will they want to even, I'm doing, let's say, an application. Do I have to worry about, because my name is Tanisha, will they call me? If I get past that name portion of it, now I'm going to my interview, should I wear my hair in its natural state? Will they accept it? How will I wear my hair? Will my natural hair say something and make them not want to hire me? When I go into my interview, let me be mindful of how I'm speaking. These are things that happen. And this is not my world now, thank God, but just the idea that this has been my experience. That feeling that I may not get this opportunity for employment because of factors related to my race. I may not have the money that I need for my family because of my race. So that feeling, is that going to breed some anxiety? Absolutely. And what if that happens to you on multiple occasions? And someone may say, Oh, it's just a job, but your job represents your livelihood, your well-being. You need your job to work, to make money, to support family. And so ultimately, we have to take it serious. And just I'm wanting you to understand that that racial trauma, that exposure constantly, that those experiences, that you have to feel that anxiety happens within your body, stress, chronic stress in your body. That feeling, how do you have a good well-being if you always or if you have that fear or the apprehension of what's to come? It's not healthy. It's not healthy. And so often when I'm working with my clients, we're talking about what's going on in the body. It's not a thing we just say, I'm stressed. I feel like I have anxiety. Anxiety is in your body. We're talking about how is it showing up in your body. And so I might hear sometimes, my stomach is in knots. My heart is thumping and it feels like it's going to beat through my chest. I have pain and tenseness in my shoulders. And so ultimately, these things, this feeling, this fear, imagine not a one-time event, experiencing that over time, your body having to rev up constantly because of how you might be treated or the impact for your opportunity, for your well-being, the threat, the harm, for your safety, emotional and physical. And how would that not impact your health? And so when with anxiety, we talk about anxiety and then we talk about disorders. Anxiety disorder, when it's interfering with your day-to-day and it's happening over a course of longer than 6 months, then of course we see depression, that discouragement, sadness, hopelessness, feeling unmotivated, disinterested, lasting more than a period of 2 weeks. We see all of this. Think about just if I gave that example of work and feeling like I'm not going to get a job, feeling discouraged, watching people around me with similar experiences, watching it, feeling discouraged because I'm looking at it like, you too. And so what's the hope? This is how people really feel. It's traumatic. It's that threat of loss, that threat of harm, that threat to your well-being. Am I going to be safe when I get in my car? Am I going to be safe when I get in my car? Am I going to be safe when I go to this location? And so this is connected to what I was just talking about now, that idea of hypervigilance, that increased alertness, alert to hidden dangers, and it's perceived. Those dangers may not physically be there, but it's perceived. I may be fine getting in my car just to drive to the supermarket 2 blocks, but I may perceive a danger because the police station's down the street and I don't know, I got to make sure I've got my hands on the wheel, or I have a child and he's driving now and he's a teenager and the store is only a few blocks away, but I don't know. And there's a threat, but maybe it's not. I don't know. So I had this increased alertness, right? That hypervigilant state that we're always in. And it can be a manifestation of that anxiety, which is that constant fear and worry, a manifestation of the PTSD. And that body is, when it's constantly on alert, your body will experience fatigue and exhaustion. We don't realize or we don't think about the nature of this machine that we have. And so things break down the machine, certain things. That's hypervigilance state. So I want to just give another example of that fight, flight, freeze response. You're in the forest, in the woods, and there's a bear. And so you're going to figure out whether or not what you're going to do. You're going to run like Forrest Gump in the movie and just keep going. I mean, Forrest wasn't fast, but you're going to run, right? you're going to be frozen and you're going to be like, oh my gosh, I don't know what to do. There's a bear, I don't know. And just start screaming, I don't know. Or like some people have done, I've heard of stories where people say, I've heard that if you get up in that bear's face and you go and get as big as that bear, that is what will save you in a situation like that. So you're in the forest, you're in the woods, there's a bear. That is a situation someone may never encounter in their lifetime. Or maybe once in your lifetime you went hiking and you experienced it. I don't know. If you are on, and so think about biologically, fight, flight, freeze, what's going on internally to your body, what has to happen so you could be as big as that bear? What the adrenaline, like your everything is happening, all that body reaction, that machine is working. If you have to be hyper vigilant and feel like you're fighting a bear or you're going to encounter a bear every day, that's fatigue. That's exhausting. That's harmful to the body. So we're designed to be able to deal with this stress. But if you're going to feel as though you have to face the bear in the forest every day and you're hyper vigilant, your body is experiencing such extreme wear and tear. So you're able to deal with certain things. But when it's over and over and over again, when you're always having to fight the bear, when you're always having to worry about something, when you always have to be on alert, am I going to get that job? Is my son going to the store? Is he going to be safe? Is he going to make it back home? He's 17. He wants to go in his car and he got his license and be with friends. But I'm nervous. I'm a mom and I'm on alert. And every time my phone vibrates, my heart beats fast. So you're telling me that as long as I live and he lives, every time I know he's going out, when he becomes a grown man and he's out, I'm now going to be on this state of alert because of everything that I've seen going on, because of these experiences, because I know what racism looks like. That's traumatic. That's trauma. And the trauma in our health, no bueno. So we have physical pain as an example of more impact. And we talked about mental, so now we're switching over to physical. And so that physical pain. And so in actuality, there are studies that have been done with medical professionals that they perceive African-American patients to have denser skin as well as having a higher pain tolerance. They got it from somewhere. They ran with it. It's been passed around. Think about, we talked about slavery before and just like dehumanizing and whipping, beating, treating like nothing. And that myth starting then that we just have this higher tolerance for abuse, for beatdown. So this literally, medical professionals were believing that our skin is different than theirs. So as a result of our skin being different, that our pain threshold is different. And so often, even through other studies, finding that African-American patients are often undertreated for pain. Given less, not that we need a lot of pain medication, that we should have it because we are aware of what's going on now with opioids. However, but information statistically showing that we receive, even through surgeries, less pain medication than our white counterparts. Cardiovascular disease, we're more likely to die than the non-Hispanic whites from heart disease. Hypertension, constant spikes and elevation in our blood pressure, right? Your blood pressure raising from that stress. Because we talked about that body being the machine. And so what is happening ultimately when you're hypervigilant, when you have that chronic stress, when you're experiencing that anxiety, what is happening to the inside of your body? What's going on? So your stomach being knocked, your chest tightening, What's happening when your heart has to thump hard and beat harder? Revving up, slowing back down. Do that to your car. Rev that engine up, start it, stop it, start. See if that doesn't damage your engine over time. So that constant exposure that we experience over and over again. And so ultimately, we have those respiratory issues. As asthma is the example that we as a people experience asthma more than any other group, any other racial group. Now that it can be tied, and it is in many cases, to genetics, right? But ultimately also tied to inequities in healthcare. There's research, they're researching it. Why do we have asthma more? Yes, genes, right? Yes, biology, right? But ultimately, inequities in healthcare and those social determinants that were talked about with that definition with CDC, environmental factors, socioeconomic status, making us more susceptible to asthma. We're re-traumatized over and over. And one big way we are re-traumatized is the media. The media plays a big role. We watch other people die at the hands of police. Gave two examples, George Floyd, Philando Castile. Physically being able to watch someone, because I believe Philando Castile was, his partner had Facebook Live on. George Floyd, we watched it over and over again. And then we re-traumatized as the trial happened, when we really got more in depth and more details about what happened, even the extension of time that he was on the ground with a knee in his neck. So watching it over and over again, right? Watching the news story of 8 church members and their pastor be murdered by a white supremacist domestic terrorist. Watching the news story, hearing that, I will be absolutely honest, and I'm sure someone listening to the sound of my voice may have had a similar experience. After that occurred, as much as I love going to the house of worship that I attend, you are now in somewhat of a hypervigilant state. I was hypervigilant. Yes, I believe in God and his covering, but I was hypervigilant. When someone would come, I was a member of my church and had been there. So everyone coming through the door, I knew. So when someone would come through, I'm looking up, feeling uncomfortable in my place of worship. The hypervigilant, maybe when someone walks in and I'm not familiar, like feeling uncomfortable. And so ultimately watching and hearing the story and me going to get my spiritual self-care is a part of my well-being, is a part of something that helps my health. But knowing that you can't go to church and feel safe, feel that you're free from harm, that you have to be hypervigilant, that church is every Sunday and you're experiencing distress every Sunday because you are traumatized. Hearing the 911 call after Trayvon Martin during the trial, hearing the call, hearing when they were playing, when someone had a recording of a scream and they were like, oh, is it the George Zimmerman scream? Was it Trayvon Martin? Knowing that he was walking to the store to get snacks, and knowing you have children that go to the store and get snacks, re-traumatizing over and over and over again. Being fired at work because of your hair. And when that definition earlier, your workplace, the inequities, being devalued because of your skin, feeling the stress of that. I came across a story of a woman, a news anchor from Jackson, Mississippi, who was fired. Her name was Brittany Noble. She was fired because of workplace discrimination. And so one example of that, after fired at work for your hair, was she was told by her news director that her hair was unprofessional and that her hair wearing natural was the equivalent to the news director going to the supermarket in a baseball cap. He told her that. He did. That going to the supermarket with his baseball cap was the equivalent of her wearing her hair the way it grew out of her head. So fired from your job because of how you want to wear your hair. Or there were other incidences where she wanted to do news story related to Black people and the comments she received. But just for showing up in the world the way that you are, that you may not have your job, which in turn feeds your family. And she had just had a baby. So tell me that's not traumatic. And we have to stop looking at trauma simply as not to diminish, never to diminish. That someone was just in an earthquake. You were in an earthquake, absolutely. You're involved in a tornado or an accident. You were in war, absolutely, absolutely traumatic. Deserving of help, support to manage the symptoms and get through. But then we have to look at the other side of it. When you're experiencing trauma, that perceived, that harm, that fear of loss, of serious loss, that threat to your physical and or emotional well-being. And so it's every day simply because of how your skin is, because those systems are put in place so that you have challenges with housing, so that there are challenges with your education, and you're told that we got to go to school, and we should go to school, and education is the key to your success, to your livelihood. But then you don't have the opportunities. Trauma. You're watching the media, and you're watching people get killed. Trauma. You are educated, as I said, but you hear your professor, and it's played for the whole world to hear. Your professor is on a Zoom call making disparaging remarks about Black people, and she teaches you. And so how do you feel? Are you hypervigilant when you have another white professor? Are you feeling like it's going to impact your grades? You feel that stress every single time you register for classes? Do you have that anxiety that's ongoing your entire experience? So when I hear all of these incidences, when I see it over and over again, when I'm re-traumatized by not just the news, by cable news, by social media, by viral videos, I'm saying that could be me or my brother. That could be me or my son. That could be me or my sister, and so on and so forth. And so it is the same idea as when we are experiencing someone close to you, and maybe a neighbor or someone passes away, or you come to terms. The closer death is, and I'm giving an example, you come closer to your own mortality. So when we are witnessing things or in close proximity to these things through media, through watching, experiencing, through hearing someone got fired for your hair, don't tell me that we're not traumatized and that it does not impact our health, that our heart's not beating faster, that engine is not revving up, that cortisol, that adrenaline's not pumping, that stress isn't chronic and it's over and over again. So we're to re-traumatize. And so that when we hear of the hypertension and the high blood pressure, and it's us experiencing it, it's just not us as Black people experiencing it because it's just us. We have to look at the correlation between the racial trauma, the hundreds, the centuries, over a century, right? The hundreds of years of this ongoing, and now that constant exposure to it. So I wanted to give just some more examples, other ways we are impacted, how it impacts our health. We have imposter syndrome, and we're going to cover that. That's going to be in one of our sessions coming up. And basically, that's doubting who you are, your abilities, and just feeling like you're a fraud. And the most accomplished, successful people experience imposter syndrome. So just think about this system, these things in place that have told you, like, your hair is like when I go to the store with a baseball cap on, right? And so ultimately hearing that, experiencing that, your employment impacted, where you live, your ability to obtain wealth, and things are in place to get in the way of that. Then we have assimilation. Just the idea of, if I'm not good enough, then I need to conform to society. I need to drown out all parts of who I am and just kind of blend right in. Figure out, how do I blend? How do I blend? How do I conform? Because I want to be accepted, because this is hard. It's hard to feel how I feel. It's hard to go through this every day, and it's hard. That self-hate, that rejection, what it does to you, internally, mentally, emotionally. Relationship issues, as I stated earlier, the inability sometimes to trust, putting up walls, having these experiences that over time are impactful to health. Your health, your physical health, but also your mental and emotional health. If you're not able, you struggle with building relationships or making connections, that impacts your health. And so we have to see the connection between what we've experienced as people, in terms of racism, of bias, how traumatic it is, and how it impacts our health. So what can we do? These are suggestions I've given often. Recognize and understand the symptoms of racial trauma. How is it impacting you? Recognize what it is. We talked about what symptoms look like. Be aware. The awareness is always the first step. Then, if you're aware of those symptoms, you're going to ask yourself, how are those symptoms specifically impacting me? Like, what's happening to me? What's going on with me? I'm going to practice the utmost self-care. And like I said, I always say with self-care, it's not just about spas or nails, it's all of those things, but really taking care of yourself. And so if we know we have these adverse health outcomes, we got to step up our game with our health. That means proper everything, because I didn't go into detail about other things like just your digestive issues, that because of the stress and lack of sleep, and your body needs your sleep. It's how that brain processes your day, how your body restores everything. And so when we don't have appropriate sleep, there is a long-term impact. There are deleterious effects to it, and not sleeping appropriately, it impacts everything. And so you can't not sleep and be healthy. So I didn't talk about sleep. So when I say self-care, appropriate sleep, eating appropriately. So if you know we're more prone to blood pressure, high cholesterol, making sure eating is together, practicing self-care, engaging in mindful activities. With anxiety, we're always having that excessive worry about what's to come. What if my child goes to the store, or they do that, what's going to happen? What's going to happen next? Will I be able to be successful? And so on and so forth. Will I make it? We're going to go on a road trip with my family. Will we be pulled over? Like, just that feeling, overwhelming feeling of that. Just engaging in mindfulness, working to be in the present moment, deep breathing, focusing on what's going on right at that moment. What are you needing? What do you need to do? How do I need to take care of myself? Just being very present, focused as much as possible. Connecting with others in your community. And so getting with people, having these conversations about race and people's experiences, and how do you support each other? What can we do together? And what is your experience? Because sometimes with these situations, I said trauma was personal, but sometimes you just feel so isolated. So connecting with your community is so important. I say this often, limit media intake. Limit it. You don't need to be re-traumatized over and over and over and over again. And it doesn't mean if you're not watching it, that means you're not being helpful. I know many of us want to be activists. Decide how you're going to be an activist. Activism looks different on everyone. You know, you have to be an activist in a way that is healthy for you, and it looks different for every person. It is not always frontline. There are so many different ways. Deciding what's healthy and what works best for you. And of course, as always, I wouldn't be a mental health professional if I didn't say getting professional help. There are so many therapists trained in trauma work, specifically with issues, trained in being sensitive, holding space for people that look like us, and being able to provide the support to help you work through your trauma. Seek that out. It's very, very important. And so now we're going to have our reflection activity time. We're going to get a journal prompt. So get your journals, your pens. And so I read this statistic, and I don't know how accurate it is in the sense of it's just a reporting piece, because I know that the number is higher. So 60% of Black Americans reported experiencing at least one experience of racial discrimination. And so at least one, I know it's more than 60%. It's probably more than just one. And so that's just the reporting on, the experience of it. We talked today about you could directly experience something as it relates to discrimination, and it could be a direct impact. Like you physically had this experience, or as we talked about with the exposure is traumatic, and the exposure is tough. But we've had these situations in our lives where we've experienced discrimination based upon our race. So I want you to reflect back to when you were younger, and when did you learn that the world saw you differently than other races? There's this moment for everyone where we understand that something's different, that we're seen differently. There's an innocence that we have, and then there's that moment everything changes, and we realize that the world sees us different. And in my work, I hear those stories. I get to hear some stories where that moment when you realize that you were seen differently. And so I want you to reflect on that, write about that moment, what that felt like. Did you talk to anyone about it? Did you process those feelings? Were you not really, did you, like many children, just, you kept it moving? It impacted you, but you just kept going. So just kind of reflecting on what that looks like and what that is for you, and sharing that in a journal entry. So as always, I am so thankful. I hope this information today shared about racial trauma and your health was informative. I hope that you're able to take it and grow from it and do something different. Share the information with someone, making sure that we are healthy. And as always, especially in light of what we discussed today, take care of yourself, take care of each other, and please be well. See you soon. Bye-bye.